We've learned about the anatomy of the brainstem and how to label the cranial nerves and where they come from. And now it's time to learn about the perfusion to the brainstem, so the blood supply. Welcome back to MedBites. This is part 3 of Neuroanatomy Without Crying. In order for you guys to be able to label the blood supply to the brainstem, it's important for you guys to incorporate your circle of Willis knowledge. I'm aware that I haven't made a video about that yet. I'll make that next. But to roughly draw the circle of Willis, we are going to first draw our circle. So we've got our medial cerebral artery, we've got our anterior cerebral artery, we've got our posterior cerebral artery. Now we're going to make a spine with two legs and a big line here and the small lines here. So this is all going to be basilar. This is going to be, what was this? Ica. Yeah, so anterior inferior cerebral artery. And here we have the joining into the anterior spinal. And then we're going to make a big line here. And then we've got the branchings, which is the pica. Okay, and this is the vertebral. So we start over here. So anything below this line. We have our rules of 4, and we're going to use that to label the blood supply. So the midbrain is going to be supplied by the posterior cerebral artery. And now we got the pons of the medulla, which have a medial and a lateral side. The lateral sides of the pons of the medulla are going to be supplied by the ica and the pica respectively, so the anterior inferior cerebellar artery and the posterior inferior cerebellar artery. The medial side of pons is going to be supplied by basilar, and the medial side of medulla is going to be supplied by the anterior spine. Notice how in the circle of Willis, the medial side of the blood supplies, like the anterior spinal, supply the medial side of the medullary side. So you see the correlation here? All right. So a couple points. First, it's possible that they will ask you about cranial nerves 9, 10, 11 and pica in general, because this is a condition called lateral medullary syndrome, also known as Wallenberg. And they'll either give you the signs and symptoms, which is similar to Horner syndrome, so ptosis, meiosis, and hydrosis, accompanied with loss in pain and temperature because the spinothalamic tract, we'll go over that in a different video, also ascends along this line. And they'll ask you which branch of the spine vertebral arteries it is. So your options could either be pica, so that's the most straightforward answer, or they could just not give you pica and tell you vertebral artery, and that would also be the correct answer because vertebral artery is a branch of, pica is a branch of the vertebral artery. So that is the blood supply to the vertebral, to the brainstem. And yeah,